we talked a little bit about it before, that when your blood pressure goes up, you get that damage to the inside of the lining, and this kind of explains it. It went pretty fast. So if you have any questions on it, we're going to go through some more of it as we go anyway. So if you ever have been confused about what hypertension is, don't feel alone, because the medical field always makes things more difficult than it has to be. There's numerous different groups of individuals, doctors, specialists, whatever, and they all get together someplace at some fancy resort and they make stuff up. And these are different groups, the JNC, the ACCAHA, and the ISH. They are different groups of physicians that try to tell you what's going on. And if you look at this, some of it, I think they're just trying to blow smoke at everybody else. But some of them, it's really pretty set that a normal blood pressure is 120 over 80. That's kind of the normal blood pressure. But where I get a little mixed up myself is they say high blood pressure is from 120 to 129 and 80 to 90. And it's like, that's still really normal. And your blood pressure is not going to just sit at 120 over 80 all day and just kind of go lumping along. It's going to go up and down. It'll be 170 over 110 if you're trying to run away from a bear. It'll be 90 over 50 if you're sitting in your chair, just resting. So it'll vary depending on what you're doing and what's going on. Stress, you can be stressed, and that'll make your blood pressure go up. It's your body's response to try and get blood to places that need blood. It should. If it doesn't, you're in trouble, because if your blood pressure, in fact, when I do stress tests, what I'm looking at is I'm looking at somebody, I'm watching their blood pressure and their heart rate. And when they're exercising, I want to see that go up at a certain rate. And if I get you to about 5 or 6 METs, and all of a sudden your heart rate starts to drop and your blood pressure starts to drop, it means your heart's not working right. And I have to stop that thing right now, and we need to get you to the emergency room, because you're probably going to have an MI, because there's not enough blood getting to your heart to make it work like it should. Because your heart and your blood pressure should go up when you exercise. And if you're in good shape, when you stop exercising, your blood pressure and your heart rate should come down really nice and steady and be back to normal within a couple of minutes. So that's another indication of how healthy you are based on blood pressure and heart rate. But this is just to show how it's pretty confusing a lot of the time. But they talk about stage 1 hypertension being greater than 140 over 90. And if any of you have a DOT card, 140 over 90 is the magic number. If you're over that, you don't get your card. If you're under that, you get your card. If you don't meet the 140 over 90, you need to get started on medication and do home monitoring and all kinds of stuff, and be able to drive. And then the best thing to do is to be doing home monitoring, and 2 of these groups didn't even talk about that, which is weird, I think, because whenever somebody gets their blood pressure checked in the office, I ignore it, actually, unless it's like 220 over 120 and you're having stroke symptoms, then I might look at it. But if your blood pressure is 140 over 70 or 80 in the office, it's probably 120 over 80 at home. And if I base my treatment on what your blood pressure is in the office, when you go home, your blood pressure is going to be 90 over 50 and you're going to be in a puddle. And that's not good. You'll be passing out every time you stand up. So it's best if we...
Blood pressure before I come in, that would be normal. You come in and some of the nurses will get your blood pressure up too. But,
yes. Yes, they will.
It's normal at home, and when you come in, you get the white coat syndrome, and it's elevated some.
You missed the white coat syndrome slide. I'll have to show it to you later. Oh, that's in your packet. It's the white cat syndrome. Anyway. So yeah, it's very, very important to do home monitoring. So if you need to have a home monitor and know how to use it, they're very simple. And the newer ones, you just pop it on, push a button, and away you go. It's very slick. So a little bit of that. So, intervention. The best thing to get rid of blood pressure is to basically do all of these things, and then you don't need any pills. So, DASH diet, and you have a handout on the DASH diet. There's a pretty extensive bunch of information there about that. It's basically the Mediterranean diet. It's mostly fruits and vegetables, less saturated fats, less dairy products, blah, blah. You know, basically if it tastes good, spit it out. Or don't eat nearly as much of it, because that's really the key thing is portion control. Almost all of these things are portion control. I mean, if you look at it, it says you can have a cup of noodles or half a cup of this and a half a cup of that. And I don't know about you, but if you went to the restaurant and they brought you a half a cup of anything and put it on your plate and charged you $20, you'd be pretty ticked. But that the problem with everything is portions. They're just too big. So the DASH diet really is pretty reasonable. You can eat just about anything, just not very much of it. And what you need to do is put the aerobic exercise in there with it, because the two things together, watching your diet and exercising regularly, are the best things for your heart, your lungs, for your whole body, for your brain, for your mental health. Exercise is the best antidepressant on the planet because it releases endorphins and enkephalins, and so it basically gives you a high, and so it makes you feel better. That's. I hear you. I hear you. I have a hard time with that myself. So, not your wife's food, but any food. I have. So the DASH diet, and then really watching your sodium. We get way too much sodium. Evolutionary wise, salt was hard to come by, and so our bodies are meant to hold on to tons of salt. And our kidneys are just revved up to hold on to salt because it didn't used to be something that was readily available. Now it's everywhere. It's in everything. And it's just, there's too much of it. And when you increase your sodium intake, you increase your blood pressure. So potassium salt substitute, there are a couple of potassium salt substitutes that are actually pretty good. They have fairly good taste, and they have potassium in them, which is something that helps lower your blood pressure. So that's a good thing to get a shaker of that instead of a regular table salt. And as long as we're talking about salt, salt is salt, sea salt, pink salt, white salt, green salt. Salt is salt. Salt is sodium chloride. It's just a matter of where it came from and how much crap is in it. If it's got a funny color to it, there's some chemical in it that makes it that color. So it's not just salt, it's something else. Sea salt, any salt that is anywhere that's being mined in the ground used to be sea salt. So if it's in the ocean, it's the same as the stuff that's on land, it's just dried out. So salt is salt. It doesn't matter. You can't just say, "Oh, I'm using sea salt. It's better for me." Not really. But it's a good rationalization. I like it. But aerobic exercise, very important. This is probably the most important thing. This and diet are the two things that Americans don't get enough of. Well, they get too much of one and almost none of the other. And that's the problem. It's like there's an imbalance. There's more calories going in and no calories going out. You know, that means everybody's got an extra, well, on a day like this, having a little layer of fat's a good thing. But other than that, not so hot. But weight loss is always a good thing. Watching your alcohol consumption is very important. You know, that varies depending on which magazine you read or which alcohol producer you read. Women are supposed to have 1 drink a day maximum, and men can have 2 drinks a day. And that just doesn't seem very fair to me that women are getting, you know, but I think a drink a day or 2 drinks a day is more than you should be drinking anyway. But that's what's been considered normal, and it doesn't lead to increases in your blood pressure. But if you're drinking more than that, your blood pressure will go sky high. If all you're taking in is alcohol, you're going to have blood pressure problems, and it's hard to treat because if you don't get enough alcohol, you go through withdrawal and your blood pressure goes sky high. So that's a major problem if you're doing too much drinking. Avoiding tobacco and alcohol will lower your blood pressure. There's lots of other drugs, cocaine, ecstasy, whatever. If you're doing those, your blood pressure is going to be sky high. Those things just really nail your blood system and cause troubles with hypertension. But you can see that you get big drops in your blood pressure, your systolic and your diastolic, with one or the other. And when you combine all of these things, you can drop your blood pressure down to nothing. Well, to normal anyway. You don't want it to be nothing, but normal. And that's the key to treatment. I mean, I can give you a medicine that's going to lower your blood pressure. I mean, I can make your blood pressure like with the medications that we have, but it doesn't make you feel any better, and it doesn't fix anything. It just makes your blood, you're just treating a number. So when you come in and you're having blood pressure issues, this is kind of the main thing we want to make sure of. First is a blood pressure measurement. Is that your blood pressure or is it not your blood pressure? That's the key thing. I mean, what is it at home? So generally when you come in, if your blood pressure is high when you see me the first time, I kind of disregard it unless it's causing some troubles. If you're having chest pain or if you can't talk very well or something else is going on, then that's a blood pressure that needs to be treated. But if you come in and your blood pressure is 160/90 the first time I see you, I just say, here's a blood pressure cuff. Go home, check it 2 or 3 different times a day for the next 2 weeks, come back in, and we'll see what it is. And if your blood pressure is doing really well at home, no reason to treat. And you come back in and you see that white cat again, and it shoots up. That's what it is. So unless that's the main thing, is make sure that you actually have high blood pressure, not just white coat syndrome. Normally, we like to get a 12-lead electrocardiogram because how that looks will tell us if your heart's being really strained. If your heart's really being strained, there's signs on the EKG that'll show up that we can say, yeah, you really need to get your blood pressure under control, and it'll kind of indicate if we need to do other testing like a stress test or have an angiogram or something even more than that. We'll want to check a blood glucose level because if you have high blood pressure and your sugars are high, you're really at risk for heart attack and stroke. If you have high blood pressure, high sugar, and high cholesterol, then you're really, really, really in trouble because those 3 things all go together and cause problems. So, it's my wife, no big deal. So blood glucose level, really important because if you have those 3 things together, the lipids are really important because that's one of the agents that's in your blood when your vessel's getting damaged by the blood pressure, the cholesterol likes to sneak in underneath the lining there, and that's what builds up plaques. That's what makes your blood vessels smaller and smaller and smaller, and that's what causes your blood pressure to go higher and higher and higher. And at some point, those plaques, those cholesterol plaques, they break and they leave a little bit of stuff floating around in the vessel, and that's when your platelets go, we're bleeding inside. Boom, they hit it, and that's when you have the heart attack. That's what a heart attack is. That's what a stroke is, when that stuff gets clamped off really fast. So very important to check that. Serum calcium levels, you want to have good calcium levels because that's what helps with muscles and helps with the contractility of your blood vessels. The creatinine and glomerular filtration rate, those are kidney measures. Those tell us what your kidney is doing and how well it's working. And as you get older, your GFR, the glomerular filtration rate, goes down, and your serum creatinine tends to bump up a little bit. And that's why you tend to see blood pressures kind of creeping up as you get older. But we like to keep an eye on that because some of the medicines that we treat for the kidney make it worse. And that's because the kidney is super, super important in controlling your blood pressure. And there's a handout on there. I mean, it's very confusing. It's got all kinds of little lines and chemicals and things. That's meant to be confusing. It's called a confusogram. And that's just the beginning of what the kidney functioning has to do with your blood pressure. And if you look on there, there's two things. There's an angiotensin converting enzyme, and there's an angiotensin receptor blocker. And those are two important things to look at. In the next couple of slides here, we're going to get to what some of the medicines do and how they work. And this kidney thing is just part of all the different things that go on with your kidney, moderating sodium and blood flow and all that kind of stuff, and really does make a big difference in your blood pressure. So we want to make sure that those are working right. Serum potassium level. The potassium will go up if your kidneys aren't working. It's one of those things that the kidney really does a nice job of maintaining a level of potassium. And all of the sodium, potassium, calcium, all of those things regulate blood vessel constriction and dilation. So the levels of those really make a difference on what your blood pressure is going to be. And the potassium, if it's too low, your muscles won't contract. If it's too high, it'll make your heart go into fibrillation. So it needs to stay at a nice level, and the kidneys are really, really good at maintaining all of that stuff if we treat it right. If we exercise, if we do a diet, if we don't use alcohol, if we don't take drugs, all that kind of stuff, the kidneys are really good at doing that. But when we mess them up, they don't like it. So, and microalbumin, and that's a urine test that tells how well your kidneys are working. So all of this stuff here is pretty much, and the glucose, those things are all related to the kidneys. That's how important the kidneys are to regulating your blood pressure and making sure that your body is maintaining itself properly. So these are some of the blood pressure medicines that we use. Not all of them. The list would be 7 or 8 slides. This is what some of those people that were at the fancy resorts and making up stuff, this is what they came up with, a lot of them. And so these are the main treatments for blood pressure just right out of the chute. So you'll see, I don't know if you guys can you guys see okay? Yeah, oh, you got the handout, okay. So angiotensin converting enzyme, that's benazepril, enalapril, lisinopril, Vasotec, probably I'm sure somebody's on Vasotec, or I'm trying to think of another common one, but those are all angiotensin converting enzyme pills. That's that confusogram. What happens is there's angiotensin 1 and angiotensin 2, and there's an angiotensin converting enzyme that changes angiotensin 1 to angiotensin 2. And angiotensin 2 goes to all your blood vessels and makes them shrink up. So when your kidney's cranking out angiotensin 2, your blood pressure goes up. We give you a medicine called angiotensin converting enzyme inhibitor. So it stops that enzyme from making 1 go to 2, and your blood vessels expand. So your blood pressure goes down. Amazing. So that's what that confusogram tells us. And so that's one of the main treatments now. This is really kind of the mainstay, kind of the initial medicine that most people get, other than maybe a thiazide diuretic. A lot of times we'll put somebody on a diuretic first, but then these two medicines together generally work together very, very well. So they usually get put in combination. Most people with a blood pressure issue, it takes more than one medicine to get you under control. So you have to keep coming back to the doctor and getting, checked and make sure that everything's good, because it's generally going to take more than one medicine. So this angiotensin converting enzyme is one pill. This is sort of the mainstay. Angiotensin receptor blockers. So angiotensin 1, angiotensin 2, ACE inhibitor goes to angiotensin 2, angiotensin 2 has to go somewhere. And when it goes somewhere, there's a receptor on your blood vessel that it hits it and constricts it. We give you a medicine that is an angiotensin receptor blocker. So it blocks that chemical from making your blood vessels go like this, and it opens them up. So basically, all the medicines do is counteract what your body wants to do because of all the bad things we're doing to it. No diet and exercise and all that stuff. All the bad things we do to it, we counteract it with this medicine by stopping some of the chemical reactions that their kidneys are trying to jack up the blood pressure for. So, like I said, I can make your blood pressure nothing by giving you enough of this stuff. I mean, we could make you a limp noodle. And the problem is that you don't feel very good, and it doesn't fix the underlying problem, which is all those things that we need to fix. That's why when you come in, we don't just throw pills at you. We say, no sodium, increase your potassium, exercise, lose weight. The problem is when you say those things, it's, because it's hard to do those things. It's hard to change what you do on a day-to-day basis. It's really hard to work all day and then go home and put on some gym shorts and go running for 45 minutes or walking or crawling. Some people would have to crawl, but it's hard to do that. It's hard to change those things. And if losing weight was easy, I'd be about 95 pounds, but it's not easy. So those are pretty much the two main blood pressure medicines. I'm betting that you guys are probably on some of these. Calcium channel blockers, amlodipine, felodipine, nifedipine. These are older. These have been around forever, and they're used for a lot of different things too, because some of these actually slow your heart rate down, and we use them for atrial fibrillation too. So they'll lower your blood pressure and they'll make your heart rate go slower. Because there's one thing that's missing from this chart is what are called beta blockers. So receptors are everywhere, and there's always little chemicals that affect those and make them do whatever they're going to do. Well, in your heart, there are a lot of beta receptors, and beta blockers like atenolol, metoprolol, those sorts of medicines, they block that receptor and they make your heart rate go slower and they make your heart beat less. So your heart isn't squeezing as hard and it's not going as fast. So your blood pressure goes down. But it doesn't do anything to your veins or arteries. It just makes your heart go slower and it makes it beat not as hard. And then thiazide diuretics. Everybody's probably been on thiazide at some point. Hydrochlorothiazide, HCTZ. It's usually in combination with a lot of these. The problem with this one is it's dependent on your kidneys to be able to work. So if you're taking this and your kidneys aren't working so good, you might as well not be on it because it's just doing nothing. That's why this one, you'll usually get switched to this one, chlorthalidone, if you're having issues with your blood pressure still, because this isn't as dependent on your kidney function as this one is. So they all have side effects. Everything has side effects. Aspirin, if you read the insert for aspirin, you'd never take another aspirin as long as you live because according to that, it's going to kill you almost instantly. I mean, if you read those things, they all say bad stuff, and that's why I hate people that go on the internet and look up the side effects of stuff because they'll have every one of them within 2 or 3 days of starting the pill, and it's like, ugh. And you got to find another pill, and you go, well, the same side effects. I mean, if you look at these, they all have the same side effect: dizziness, dizziness, dizziness. Well, this should say dizziness because that one will cause more dizziness than anything. But yeah, hypokalemia, hyponatremia. That's low potassium and low sodium, low blood pressure, hyperkalemia. This one will, these will generally affect your kidneys and make your potassium go up. That's why you'll get blood tests a lot of the times if you're on these, because the longer you're on them, they can make your kidneys kind of not function as well, and your potassium will tend to drift up a little bit, which isn't a bad thing as long as it stays in a normal range. It can go from like 3.5 to 4.5 or 5. But once it gets much above 4.5 or 5, then you're at risk for having other bad things from the potassium. So as far as medicines go, these are the mainstays. The beta blockers are another one. There's a couple of different, there's different kinds of calcium channel blockers. We won't go into that because that's kind of confusing anyway. Non-pyridine ones and hydropyridine ones and whatever. It's like,
I take quite a few different meds, and pretty much all of them, you look at the side effects, dizziness, don't drive, don't operate machinery, you know, when you're kind of dizzy anyhow, you know, personality-wise. But yeah, they all have dizziness in there.
oh yeah,
Every one of them.
everything does. If you look at anything, it'll probably say dizziness in there some way. You know how they get the side effect profiles for these? I can tell you from personal experience what they do. They've come out with a drug, and they say, okay, it's safe to give to rats and rabbits and whatever. They didn't die. Okay, so next group of people we're going to try it on are medical students and prisoners. Now, I kid you not. So they take the drugs, and when I was in medical school, we got asked all the time to take this drug for a month, once a day, twice a day, whatever it is, and take this little diary. And I'm shutting my wife off. Sorry, dear. Don't tell her. So they tell you that you take this pill just like it says. It's whatever it is, and you write down whatever side effects you have. So if you had diarrhea. It didn't matter if you ate at Taco John's for. I mean, it doesn't matter. It's something you had while you were taking that medication, and so you could have. I mean, I thought, if I tried that one and I walked out onto University Avenue and a bus hit me, I'd have to write that down. Side effect of this medicine is being killed by a bus. And that's exactly how they come up with the side effect profiles for these medicines. So you got to kind of take those with a grain of salt.
30, 40, actually 40, 50 years ago, when people done a lot of sweating, they recommend take salt tablets.
Yeah, not so much. I can remember in high school we'd take 6, 7, 8 salt tablets before we'd go to practice on a summer day, and then they wouldn't let you drink. So it was like, how do you get somebody dehydrated and kill them? That's how you do it. You give them salt tablets and you don't let them drink. But that was the football mentality back then. That's why Corey Stringer probably is no longer with us. So, because it's just stupid. So. I've seen that face many, many times. It's serious.